I feel that the key performance indicators are we are as accurate in counting a 1/2 of a cent acetaminophen generic aspirin as we are counting a $1,000 chemo vial or pill. It doesn't matter what we're counting, we are accurate across the board because we want that final number to be as accurate as possible. So it doesn't matter the value because there are a lot of very, very high dollar amounts in the pharmaceutical industry, and there's also very small amounts. We want across the board accuracy on all that. We need to be aware of specifically PPE, personal protective equipment, and the possibility of a bloodborne pathogen. If a vial should break and we cut ourselves, we need to be aware of the procedures to prevent any damage to ourselves. But we also need to understand that there are times when we go into, say, an IV room or a clean room, we need to be wearing gloves, boots, hats, masks, sometimes face shields, and we still have to perform our job, even in the midst of all of the protectives that need to be used. All of that data is tracked by our database, so we're just simply entering the National Drug Code and then how many there are of that particular item. There are certain things that we do have to count differently, like a controlled liquid, and there are 4 different levels of, well, there's 5 different. One is street drugs, so we never do those, but 2, 3, 4, and 5 controlled drugs, like a liquid. We don't just say it's a half a bottle or a third of a bottle. We actually take those down to the milliliter. And so we need to understand how to process that out. Sometimes there are syringes that are filled out of a bottle and there's 3 cc's or 3 milliliters in that syringe, and there's 62 of those syringes. We need to do the math to say how many actual milliliters, how big is the original bottle, and then take a percentage out of that. So, I mean, those are the things where the accuracy, again, plays a big role specific to the drugs themselves. The need for a hospital to have a full coverage of product for whatever is being presented to the upper floors where the patients are, to know that they've got 3 vials of this particular medication in this particular strength, that I think their inventory control then can say we need to have a minimum of 5, maybe a maximum of 15, so they can then, their buyers can order more when they get our numbers back, that they can say we need more of this, and so they can have a more accurate number of product to be used for patient care. Even as we're doing an inventory, some of the techs in the pharmacy can say we need to get in here because we got an order that we got to take these out, and so obviously they're helping patients. We're making sure the product, the supply is there and what the numbers are, but they're the ones helping the patients. And if they come up to an empty bin, now they've got to call back to whatever nurse's station, contact the doctor. We don't have this, what else can we use? And so, I mean, yeah, it's probably a kind of a symbiotic relationship that we've got, because we're making sure the product is in supply, they're taking the supply and giving it to the people who absolutely need it.